Women holding off getting pregnant during the pandemic? I'm going to speak with our favorite twin doctors about whether that's a good idea. Because of concerns surrounding coronavirus, many women are waiting to get pregnant. A recent survey found 40% of reproductive age women plan to significantly delay childbearing. Is this a smart call? Let's bring in the experts. The twin doctors join us. Dr. Jamil Abdurrahman and Dr. Idris Abdurrahman are both OBGYNs, and we're glad you could be with us.
Thanks for having us.
So first of all, what are you hearing from patients? Are they waiting, and should they be?
We do have patients that are waiting, and whether or not they should or shouldn't, the jury's out. There are both financial concerns and medical concerns for a lot of patients. There was a recent survey that found that 50% of people have either lost a job or have someone in the household that's lost a job. 30% of people say that financially they're just doing worse this year than they were last year. And so financially, there's a concern. And then 50% of Americans get their health care through their jobs. And so, the cost of pregnancy, the cost of having children, for a lot of people, financially, there's a concern. But there are medical concerns as well. And so, I was going to say, having said that, though, more than half of pregnancies are unplanned. So while people are planning to wait, they're not always waiting.
Oh, yeah, there's always that possibility. So let's talk more about the medical concerns. I imagine that it's scary to be pregnant right now.
Oh, yeah. I mean, absolutely. We tell patients all of the time that pregnancy is a well state, meaning it's not a disease and it's a natural process. But there are things that happen during pregnancy that make you more susceptible. When you're carrying a baby, it's genetically half you, half the father. And so your immune system has to be a lot less active, or your immune system would attack the baby. Problem is, if your immune system isn't as active, it makes you more susceptible to getting infections and getting sicker from infections. And so we do see that pregnant women with COVID tend to do more poorly. About 5% of healthy women will be admitted to the hospital if they get COVID. Almost 40% of pregnant women will. And pregnant women are also more likely to be admitted to the ICU if they get COVID, and to need help of a ventilator if they get COVID. And so there are certainly some concerns, both for mom and for baby, really.
Yeah. So a lot of that also has to do with the anatomical changes of pregnancy and its effect on your lungs, too.
Oh, definitely. I mean, it changes your body so much. And what do we know about what it could mean for the baby if mom has COVID?
So, right now, actually, the jury's somewhat still out. The risk of both miscarriage, preterm labor, and stillbirth increases by about twofold. So it doubles in pregnant patients that have COVID. So in that sense, of course, it's bad for baby. But there are some good aspects as well. So when mom is pregnant, anything that she's exposed to, the baby's going to get those antibodies across the placenta. So that can give baby some temporary protection. And if mom is breastfeeding after delivery, that can give baby some temporary protection as well. Studies have found, and it's still kind of early in this whole thing, that COVID can infect the placenta, but there have not been any instances of what they call vertical transmission, where COVID goes from mom to baby. So it's kind of a mixed bag.
We just reported here the first baby born with COVID. So I guess it can happen, which has got to be worrisome.
It's a little bit concerning, but normally babies and young children with COVID tend to do okay. And there have been, there have been studies where they found COVID in the placenta. So the assumption is there's vertical transmission. They've had newborns that they've tested that have tested positive. And the question is, was there the vertical transmission, or did they get exposed right after they were in close proximity to mom? But there are those concerns. And given that also, though, it doesn't feel like we're new in this entire process, we still actually are. And so there's just a lot that we don't know. So those concerns are there. But for the most part, we're telling patients, if you can, consider maybe delaying things somewhat. But most of the major associations, the American College of OB/GYN, the Society for Reproductive Medicine, right now at least, they're not advising that people hold off. They're just advising that you educate, you understand the potential risks, and you make what you feel is an educated decision.
Yeah, definitely a lot to think about. Dr. Jamil Abdurrahman and Dr. Idris Abdurrahman, thanks for taking the time to sort through it today. We can always let people know that they can find out more about you, more information at twindoctorstv.com. Thank you.
All right, bye-bye.